Next, from Peoria, Glen Barton, the former CEO of Caterpillar, talks about America's troubled healthcare system. Mr. Barton offers his perspective on the problems healthcare is creating for employers and what changes need to be addressed to balance quality healthcare with available economic resources. This program is underwritten in part by the Institute for Principled Leadership in Public Service at Bradley University.
Ladies and gentlemen, it is indeed a great personal pleasure to introduce Glen Barton.
Thank you, Michael, for all those very kind words. And you know, we are number 5 in the nation, but we have 2 tough games left, and they make or break our season, and those are in Kansas. So we'll see. But it is a pleasure to be here this morning, and a pleasure to have an opportunity to talk to you about something that I've become a student of over the last many years. As Michael mentioned, during my tenure as chairman, CEO of Caterpillar, I did serve as the chairman also of the Business Roundtable's Task Force on Health and Retirement, and as a result got my feet into a subject that I realized I hadn't spent enough time on during my active years as a company. My role here today is to identify some of the key issues in healthcare for all from a businessman's perspective. I don't intend to lobby for one position or another, but simply give you some of the things to think about as you listen and have listened already to some of the other speakers. I am also pleased to see that business leaders take a more active role in this debate on healthcare. The Business Roundtable, ARP, and the Service Employees International Union, 3 highly unlikely groups, have come together recently to work together in getting lawmakers to address the issue of health care overhaul. This group has the power to reach into the corporate boardrooms, into policymakers' offices, and to the public as well. I'm sure Tom Donahue, one of our speakers later today, will also talk about what the U.S. Chamber of Commerce is doing. This business leadership is needed for the country to make progress on this very, very critical issue. Healthcare, I've found, is a very complex subject. Someone defined it as a bureaucratic hodgepodge with Medicare for the old, employee coverage for people who work for big companies, 50 different versions of Medicaid for the poor, emergency rooms for the destitute, and no coverage for people who are unlucky enough to work for an employer that provides no coverage and can't afford to buy private insurance. That speaks very well, I think, for the overall complexity of our current situation. You've undoubtedly heard the expression, you can't see the forest for a tree. But I saw one the other day that better describes healthcare. You can see deeply into a tangled forest if you peer closely. And that's something I've tried to do over the last 3 years or so. To begin with, I submit our healthcare system is badly broken and in need of dire changes. So where do we go from here? Let's first look at the positives. We have our good healthcare facilities today and excellent healthcare providers. No country has the skilled physicians and facilities we have, nor the diagnostic equipment and newest treatments we have. And it shows in the results. For example, breast cancer survival rates for women in the U.S. are much higher than they are in 2 other well-known industrial countries. If you're seriously sick and live outside the country and can't afford it, you'll seek treatment in the United States as opposed to other alternatives. The major things hindering our healthcare providers' performance are, first, the administrative costs associated with receiving compensation for services provided. Secondly, costs related to care given to the uninsured. Third, malpractice insurance, which has been mentioned by a couple of speakers this morning. And finally, the continual need to reinvest to stay competitive in the latest diagnostic and care equipment. From my perspective, there are really 3 key healthcare issues facing the nation today. Who should be covered? How do we pay for this coverage? And what administrative process do we choose? There are no easy answers to these questions, but we can make some intelligent choices. And most certainly, willingness to compromise will be essential because no one is going to get everything they want. Currently, it is estimated that 47 million Americans are uninsured at least part of the year. These are generally thought to be the young, the unemployed, and lower-income families, ones that cannot afford to buy health insurance, and the ones working at small companies that do not provide health insurance coverage to their employees. A recent study by the Robert Wood Johnson Foundation added a little more clarity to this. The study indicated that 80% of the uninsured either work or are in working families, and among the uninsured working population, 56% work full-time year-round, while the remainder work part-time, sometimes juggling 2 or 3 jobs. The uninsured health care comes largely from community health care clinics and emergency rooms at hospitals. So-called free clinics serve only 3.5 million people today, just a fraction of the number of uninsured. But this number is growing very rapidly. Look at our own Heartland Health Clinic here in Peoria, which has seen a 10-fold increase in patients over the past 3 years, and 40% that have no insurance. Most of the burden for the uninsured has fallen, get caught up here, most of the burden for the uninsured has fallen on the hospital emergency rooms, creating yet another crisis. Emergency room visits nationwide are up more than 30% in the last decade to 114 million each year, and only about 15% of that number arrive by ambulance. Despite this, 500,000 times a year, ambulances are diverted from emergency rooms that are full and sent to other hospitals further away. Emergency room patients who need admission are sometimes delayed up to 8 hours on gurneys and hallways waiting for a room to open up. Why? Because of the huge influx of people, many poor, seeking routine care, are ones with chronic diseases not under control and who cannot get appointments with regular physicians. Many are either uninsured or on Medicaid, but unable to find doctors willing to treat them. Another 6 million of these are veterans and their dependents. By law, hospital emergency rooms are required to accept all patients, whether they have insurance or not. Coverage of the uninsured is a hot political issue, with proposals ranging from mandated coverage for each individual to universal coverage.